Hi, my name's Jackie James, and today I've got with me Laura from the Reflexology Association of Canada. Welcome, Laura.
Hi, Dr. James. I'm glad I'm here.
Do you want to just tell us a little bit about yourself and your reflexology journey?
Sure. So my name is Laura Marrast. I'm the Director of Operations at the Reflexology Association of Canada. I've been with the association going on 11 years this fall. Can't believe where the time has gone. And I fell into this job. So I wasn't initially trained in reflexology. I I actually was living in the UK, couldn't get a visa renewed, had to come back to Canada. I'm originally born and raised in Winnipeg, Manitoba, in Canada. And I was puttering around for a couple months, and a friend of a friend said, "Hey, they're looking for, someone to hire at this office. Go interview." And I did, got the job, and then I've been here the last 10 years. So, through that time, I of course learned about reflexology. I've audited both a foot reflexology course and hand reflexology course. Hand is my modality. That's the one I love. Um, and I practice on like my mom and my friends and family, but I don't see, paying clients. And I'm not officially registered. So I don't, charge anyone and I don't practice professionally. But I do support all of our members across the country here in Canada. And yeah, lovely to have this. Thank you for inviting me. Looking forward to our chat and just, yeah, going from there.
Okay. So, first of all, can you tell me how reflexology developed in Canada?
So, the Reflexology Association of Canada has actually just celebrated its 50th anniversary here in Canada. So, initially, a group of therapists was trained back in 1976 in Toronto in the Eunice Ingham method. Now, funny enough, we've actually traced roots of reflexology back earlier. We had, I'm sure you know Spiros from orthopedic reflexology out in Greece. So he had found, and I should have written it down, the name of the gentleman who was this doctor in Toronto back at the turn of the 20th century, who was actually doing reflexology on Canadians and anyone who would come really, because people were coming up from the United States, doing a type of reflexology here in Canada, but it really got more formalized in the 70s, with the Eunice Ingham method. And then it's developed since then. Canadian reflexology, especially for hand and ear, for those who do the protocol that's been developed by the Reflexology Association of Canada, and those in hand and ear, greatly influenced by Beryl Crane from the UK. So she came over and taught a lot of therapists in the 80s and 90s, and she was instrumental in helping the association develop their initial hand and reflexology manuals and protocols. So that's where a lot of the big influences, but of course, because reflexology is so international, other protocols that have been developed, specializing in like fertility or specializing in the lymphatic drainage or finger free, which has become really popular. All of those, of course, have
Mm.
come over and people have been incorporating those into their practice.
So you've got a bit of so it's grown, it's changed from what first introduced.
Yes, definitely.
So, as a profession, the Reflexology Association of Canada, how has that changed over the years?
I think it's especially in the last 10 years that I've been here, it's really gone
Really
from
gone
being
from being
sorry, there was a weird echo. Gone from being a part-time profession. A lot of times people were using the word hobby. A lot of therapists were doing it as a second job or after they've done, their main career, they get into reflexology and, a lot of family and friends, not everyone was doing it professionally. To
Mm.
now, the majority of our therapists now, this is their primary profession or job. Um, People are getting into it full time. They're building thriving businesses. It's becoming more accepted from the public, but also from other healthcare practitioners. So we're seeing a lot more therapists work in integrative clinics alongside, massage therapists and nutritionists and chiropractors. And I've got a couple therapists working at a dentist offices, which are pretty cool. So I think it's really grown from being oh, this might be something, mom or grandma or grandpa and uncle did on the side to actually I could get into this out of high school and really make this like I could be a full-time reflexology therapist or combining it with other healthcare modalities, I can make this a career. So I think that's been
That's
the biggest
yeah,
shift.
that's great. So what's your business model for your therapists? Are they self-employed? Are they employed by the clinics?
So the majority of therapists are still self-employed. This does allow people a bit of freedom, so you're not necessarily tied to one clinic space. You can, be mobile, work from home, work out of one or two or three different clinic locations. But we've seen substantial growth in the number of therapists either being hired directly by clinics or subcontracting from clinics. So they're still independent practitioners so that they can, again, manage their business in terms of, they're not necessarily tied to one clinic, but then that clinic, if they are hired as an independent contractor, will handle all of the, the bookings and the room and the materials, and they don't have to worry about that. They can just show up and do their appointment. So I know a lot more therapists are preferring or enjoying that route. Um, do have a lot of not a lot, but a good number of therapists who, start they rent their own spaces. So seeing more what we would call the brick and mortar reflexology locations. So you'll see a sign for a reflexology space or clinic or business. So that's also changed a lot the last few years. So I think there's more opportunities for people to develop the business that they want and fits their
Mm,
schedules. So that, this doesn't have to be a 9 to 5 job, right? A lot of this is done on the weekends or in the evenings. Or if you only
mm,
want to work Thursdays and Fridays, you can structure it that you only work Thursdays and Fridays. So I think a lot of people like that flexibility.
yeah. I know when my kids were really small, I used to work Monday to Friday in the evenings,
Okay.
so that I'd work when they went to bed.
Oh,
And when I first started, I thought, oh, clients aren't going to come for an 8 and a 9 o'clock treatment, but they did. They loved it.
yeah. And well, because everyone works like, especially if you're getting the people who are like going to shift work or coming off of shift work. And, a lot of people, the banks here, they have these late hours now because people weren't being able to like do their banking between,
Mm,
9 to 5. So now they do these 10 to 7 or 8 o'clock business hours. So I think the flexibility is also nice for
yeah.
both therapists and clients.
So, what about regulation? And I do know this is different depending
Yeah.
on where in Canada. Do you want to explain that for us?
Sure. So Canada is unique in that the way our country is set up is we have very defined roles of like what the federal government, so the national government is responsible for, and then what our provincial and territorial governments are responsible for. So healthcare and the responsibility of the health of citizens is actually outside of a couple of exceptions, is left up mainly to our provinces. Now, because this gets thrown around in the American news a lot, there's this whole idea that, Canada has free healthcare. Um, and when in reality, we have provincial insurance plans that are taxpayer funded. So we pay our taxes, and then this is kind of goes to the federal government, and federal government distributes it amongst the provinces, and the provinces then reallocate those resources and funds to our provincial healthcare system. Because health is regulated provincially, each province has different rules and has regulated different health professions. So in Canada, for example, massage therapists in the province in Ontario are regulated as in like there's a law on the book saying this is what it means to be a registered massage therapist. This is what they can or cannot do. We leave it up to this health regulatory college to manage and make sure that people practicing massage are, fitting that bill. And then in other provinces, so I'll take Alberta right now, they're trying to get regulated, but right now massage isn't regulated in the province of Alberta, though they're working on it. So right now, reflexology isn't regulated in any province or territory in Canada, which means there's no law on any provincial government books detailing what it means to be a reflexology therapist, what education standards are, you can or cannot do in terms of scope of practice, which is where associations like ours step in and say, okay, we do need some guidelines because you are working on members of the public. There are risks, if people aren't, behaving appropriately or safely. And yeah, so that's kind of where we've stepped in. And then I guess, well, no, I'll ask, I could go on if you want me to go on, because there is a little bit about the payment issues, the insurance issue.
Absolutely, yeah, that's that's my next question.
Okay, so um, with our single payer, I guess Canadian healthcare is, it's publicly funded, privately delivered. So unlike in the NHS in the UK, where you have doctors and nurses, they're actually paid directly by the National Health Services. Our doctors are independent. They bill the province for services that they deliver. So a lot of our healthcare actually outside of, going to your family doctor, your GP, going to the emergency room hospitals, and those types of services is actually privately funded. So going to other outside of very exceptional services, going to like the eye doctor or the dentist, you pay out of pocket or you pay through private insurance. So reflexology falls into that. People pay out of pocket here, or if you have a health insurance and extended health benefits or private health insurance that covers reflexology, you use that to cover the services. It's very uneven. So plans differ wildly from insurance company to insurance company, from province to province, even within insurance companies. So I know this is frustrating for a lot of clients or even therapists, because you'll have two clients, they have insurance through the same health insurance firm or company, but one plan will have, like you get reflexology up to $500 a year, and another plan will say this isn't covered under your plan. So it's one of the realities I guess that Canadians have to deal with is our extended health benefits are very they're plan dependent. It really depends on, what package you have, which insurance firms you go to, which like if you're with a union or a specific employer, what plan they've set up for you.
Mhm.
So yeah, I guess yeah, wanted to make that clear that a lot of our healthcare is paid for through private health insurance.
Yeah, I think there's some commonalities with the UK. So I think in the UK, most people pay for their own treatments,
Right.
but it is included on some of the health insurance packages. So up to, as you say, a certain level a year. So yeah, maybe you're a little bit more advanced with that because of the way your health service is set up. So.
Yeah, yes and no. I think, well, I guess my understanding with in the UK is you do see a lot more reflexology therapists working out of like hospitals or working out of uh like government funded clinics so that they could get paid through the NHS, whereas like
Mhm.
that's not even an option here to get paid
Mm.
through like our public healthcare system.
Yeah. There's not that much of them, but there are some. So that
Yeah,
is
you're
so
starting getting in the doorway, which is,
yeah,
one of the
yeah.
good things.
So talking about your treatments, can you just explain what commonality you've got? Are they all the same like duration, or does that vary wildly? Are you using the same techniques, or again, does that vary wildly?
Absolutely. So it does vary depending on which school of training a therapist has gone through. So while the association has developed, like our foot reflexology protocol, hand reflexology protocol, ear reflexology protocol, it's not, since we're not regulated, it's not legally required you follow this protocol. So a lot of
Mm.
therapists have trained in other schools that have slightly different protocols through, continuing education. A lot of therapists have learned other techniques or protocols that they've integrated into their treatments. So
Mm.
there isn't a standard reflexology protocol in Canada. It is education dependent. Same thing with duration. So it really depends also where people are practicing. So, we've got therapists who will do these quick sort of 30-minute sessions for, business people on the go, and they just, they're fitting this in on their lunch hour, to other
Mm.
therapists where they're like, yeah, I offer 90 minutes, maybe even 2 hours, but they get everything, right? We do a full face and ear and hand and foot
Mm.
session by the end of that, 90 minutes. And then everything else in between, you know, I think the typical still, foot reflexology session lasts 60 minutes, with hand a little bit less, ear a little bit less, and face, it kind of depends, kind of in between ear and hand in terms of duration. Um, but yeah, I think that also gives therapists a bit of flexibilities in terms of their bookings and how long they want to structure their sessions.
And would you say, and this it might sound like a silly question, but is it reflex based? So you are thinking about the reflexes as you do the treatment.
Yeah, so any reflexology protocol that the association approves is reflex based. So a few years ago, we did update our definition of reflexology as any a session that you have mapped the body onto whatever body part. So whether it's the face or the ears or the hands or the feet, or the upper body, because some of those have started to develop now too, and you are working reflex points or areas
Mm.
based on that map. That's what the association considers reflexology. Now, if you're getting more into the massage or getting in that route, we wouldn't consider it reflexology. Not to say people, don't combine reflexology and massage, but if you're just, working the muscles or and you're not doing that mapping, you're not doing the working the reflex points, then we don't consider it reflexology.
When I did my doctorate, obviously I did a lot of research on reflexology, and I found more than one study where they basically just worked one reflex. Would you ever have that?
Oh, I've never heard of this. They just worked like one reflex. How would that work for
I think
that?
really. So they weren't from Unisingham. I think they were really from acupressure and
Okay.
acupuncture. And
Yeah.
so they were focusing on just one reflex. And when I was doing my benchmark, I was looking for studies and um, these studies were saying, yeah, they're reflexology. And I'm thinking, I'm not sure if they are. But actually, for me, if they're calling themselves reflexology, I think. Yeah, I've got to say, well, that is a form of reflexology. It might be different to what I do, but it's still
Absolutely.
reflexology.
Interesting. I haven't heard just working one reflex for an
Mm.
entire like appointment. Now, yeah, focusing on one or two reflexes depending on the client and their needs or their
Mm.
their issues. Absolutely. Again, from the association point of view, we I mean, the idea is like you do work the entire body. If you're doing any, you'd work both as much as possible. Given if people have both their limbs and things like that, you want to work both sides for balance. Interesting. I'll have to look that up. The idea of just working one reflex, I haven't heard that before.
Yeah. These tend to be shorter treatments, and I think it's because
Mm,
reflexology has got different ways it's developed, which is,
absolutely.
but they're still calling themselves reflexology. So yeah. Um, a question again. Do all of your reflexologists use thumb walking and finger walking?
That's a good question. So most do, but not all. So we have seen an increased use of tools. So from like the Thai reflexology side, using those Thai sticks and rollers, as well as on the facial reflexology side, if people have been trained in like the Dean Chan multifacial reflexology protocol, they use pointers and rollers and other tools to stimulate reflexes on the face. Seen a lot of that. We've had David Waite from the UK come and teach a lot of therapists finger free. So using, your knuckles and the back of your hand to get in there as well to help, save your thumbs, save your fingers. I'm sure if you've seen in the UK, after, 10, 15 years, therapists do start saying, my hands are tired or I can't quite do so
Mhm.
many treatments in a day or I can't see so many clients in a week because it does wear on your hands. So, there has been, I think, an increase in integrating other methodologies to help save your hands. So whether it's
Okay.
using tools or using, yeah, not just doing the straight thumb walking, but that's the primary.
Yeah. And another question. I know Eunice Ingham didn't use any lotion or anything. Did reflexologists in Canada generally use cream or lotion?
So this is also is going to be therapist dependent as well as client dependent. So from the association's point of view, we have said if you're properly trained to use lotions or balms, or we're starting to see an increase in people integrating essential oils, you can, as long as one, you know how to do it safely, and two, you've gotten the client's consent, because not every client, we've
Hmm.
seen an increase in sensitivities, both in terms of certain ingredients in lotions as well as smells. So it goes hand in hand. Um, I would say, prior like 15, 20 years ago, most therapists were not, they were just kind of using it as a finishing type of, like a finishing cream. I think more therapists now are using it. Um, this is anecdotally, to be fair, we haven't asked therapists recently in the last couple of years
Yeah.
if they are. But my sense is that more therapists are using it from the beginning of the treatment to the end, for, yeah, a variety of reasons. Also, sometimes grip. I know every time I do hands, especially if I'm doing my mom's, I'm like, yeah, no, I got to put a little bit of something on your hand to start working her, because
Yeah.
her just very dry.
I was trained using talcum powder,
Oh,
um,
okay, yeah.
which actually is great because of the asbestos where the
Oh,
talcum
okay.
powder's mine. So, but I know a lot of people that still use cornstarch, which is an
Yep, cornstarch.
equivalent. But I think more people use some sort of lotion or wax or essential oil
Yep.
lotion. So I think that it is different. So I'm just looking down because we're covering some of my questions as we've been going along.
Yep.
How aware is the Canadian public about reflexology?
They're more aware, not as, from the association's point of view, not as aware as we'd like them to be. Um, there are confusion with, other therapies. There, and we've also seen a growth of other professions, physiotherapists, massage therapists, acupuncturists also being trained in reflexology and integrating it into their appointments and treatment. So I know some of the confusion from the public is like, oh, well, my acupuncture does this. How is it different from acupuncture, right? And there's some of that. I think people who are in the health and wellness space, especially coming out of the pandemic, we've seen just a growth of people saying, my health is important, my stress levels are important. What can I do to help manage that? I hear reflexology can help me with that. So we've seen the people who are seeking it out are finding it. Um, and the general public sort of vaguely aware, but there's still a lot more advocacy and information that needs to happen.
I think that's a really good point, though, that sometimes people, if people are receiving reflexology from a different sort of therapist, they will
Yeah.
get confused
Yeah.
about, actually what is reflexology? And, I can see that it can cause lots of problems.
That's probably one of our biggest hurdles right now is multiple professions like doing reflexology as an additional technique, not as a standalone sort of therapy or
Yeah.
standalone profession.
Mm.
We've been in good contact with like our other healthcare colleagues to say how do we, it's not that not that we're the only people who can do reflexology, but how do we ensure that if there's other professions integrating this technique, the differences are explained to clients and the public. And it's not just happening with reflexology, this is happening with massage, this is happening with acupuncture, this is happening with in the nutrition space too. So it's not just us, but in the I think people are trying to find solutions to some of their healthcare problems. There's pros to having public health care, but one of the cons is sometimes people don't always have access to their family doctor because we do have a shortage in Canada, and we have sometimes long wait times to see specialists. here in Canada because the way you see a specialist, you can't book with them directly. You do need a referral from a GP. So in that interim of like, hey, I'm waiting to go, see a specialist about my knee pain or to possibly get, knee surgery. Who do I see in the interim? I'm going to go talk to a chiropractor. I'm going to go talk to a physiotherapist. I'm going to
Mm.
go to a reflexology therapist. And um, I think a lot of healthcare practitioners, we want to help people. So it's like, all right, what other tools can I add to my services so that the clients that I'm seeing who are, dealing with back pain or mental health
Mm.
difficulties or all these things, they can get help. Um, so it's a bit of a catch-22 of like professionals want to help people. They're trying to expand services, and then we're
Mm.
still from a professional association level or college, regulatory college level, we're still trying to figure out scope, like where some of these lines are drawn or where, professions bump up against each other, both so that it's clear for healthcare professionals, but also so it's clear for the public.
Yeah. So I've got two questions and they're related. So I'll give you the first part first. So what minimum standards have you got for reflexology training in terms of if there's any duration, number of hours, is there a number of case studies they've got to complete?
Yeah. So we look at training from a competency lens here at the association. So in our experience, longer courses doesn't necessarily equate to better reflexology therapists we've found. So we've stopped counting hours and we've said, can graduates from your course come out with these competencies in terms of knowing how to properly assess a client, properly know when to, refer outward, when to stop, when to adjust their session, systems of the body, ethics, the basic business information you need to know to practice in Canada, legal information, things like that. Now, some people have been able to do that in a shorter amount of time. Sometimes it takes a little longer. We also realize there's people have different learning styles. So again, we don't put a minimum amount of hours. We do, though, put a minimum on case studies. So we say for a certification, regardless of protocol, whether it's face or hand, we want to see at
Mm.
least a minimum of 50 case
So you
studies.
want to see how many?
A minimum of 50 per
Okay.
modality that have been
Okay.
assessed by, the school or the instructor.
Right.
So
Okay.
a lot in Canada, most practicums here for reflexology are self-led. So you might do the first couple like in class or, the school might say like, we're going to bring in some volunteers and the first, your first 5 or 10, you're going to do in front of me to make sure that you've got the protocol in your fingers. But the majority of your practicum, you're doing it on friends or family or neighbors or volunteers out in the community. So it's ensuring that all that the documentation for all those sessions you're doing out on your own is still appropriate and thorough on on these things. And then because we're not regulated in Canada and there's a vast array of reflexology training, as well as people coming from overseas or people doing overseas online training that's overseas. We, from the association point of view, we don't accept any training where it's fully online. There has to have been at least an in-person practical exam.
Mm.
And we also have a registration exam that we get everyone to do, regardless of where people have trained, to ensure that they're meeting our minimum standards. So ensuring that they understand some of the other, business, legal, ethical considerations, things we, legally can or cannot
That's
do.
really interesting. Yeah.
Yeah.
Oh, hold on. So I should have put my phone on silent. So is that exam, is it just written or is it practical as well?
It's both. So there's a written part that has a series of multiple choice and short answers and matching questions, true and false questions. And then there's a practical component. And on the practical component, people are always worried about like, oh, I don't do the rack protocol. And I'm always telling people like, we're not testing you on whether you do this protocol because when you're out there practicing, most people aren't doing one specific protocol. The assessment is a professionalism assessment. So regardless of which protocol, our philosophy is regardless of which reflexology protocol you do, there's a level of professionalism that clients should expect. And there's things that should be consistent regardless of which protocol. So in terms of your intake, in terms of ensuring that it's safe to proceed, ensuring that like documenting the session, getting consent, all of that should be the same,
Mm.
regardless of which protocol or which body part you're working on.
Yeah, I think that's really good. And I also think there's lots of ways to do reflexology that's right.
Absolutely. So not saying one particular way is right or wrong, but in terms of how we explain things to clients, getting their consent, how we're documenting, how we're ensuring that it's safe to proceed, how we're working with other healthcare providers. So if, because you'll get the client who shows up 3 days after being in the hospital being like, I just want a session. It's like, hold on. Okay, let's make sure this is okay with your surgeon or whoever just
Yeah.
released you before we start working on with you. All of that again should be similar regardless of which protocol you're doing.
Okay. No, that's
Yeah.
good. Now, my part B question is for the people that are doing reflexology as part of another modality, do you have any influence on how long they are trained for? And what do they still have to do the exams, even, do their own organizations control? I mean, we do have, I think it's a more of a problem in the UK where you can do beauty reflexology, which is fine, it's lovely, but it isn't what I do. But you
Yep.
can learn it in a weekend. So, do you have any influence over these other people doing reflexology?
Officially, unfortunately, not. So, you know, we try to work with other healthcare associations and colleges. We've explained what we do. Ultimately, if you're part of another regulatory college, you need to follow their guidelines for
Mm.
things. And yeah, absolutely. There's definitely some reflexology programs that are meant though for continuing education to be integrated into another modality that wouldn't meet they don't meet our standards of foundational training being properly trained. This does mean, however, though, that and we've seen and we have tried to bring this up with both colleges and associations of if someone has learned reflexology as a continuing education program, they really should be integrating it into whatever their primary technique or therapy is, rather than
Mm.
offering standalone sessions. But people, we have seen other professionals offer it as standalones, and that's where some of that confusion comes in from clients. It gets into the insurance extended health benefits because there's confusion on that end. So we are working on trying to clarify some of those scope and some of those practice questions. But yeah, no, it is a problem.
So, I think I've nearly got to the end of my questions. A final question, again, it's two parts. I know that you speak to reflexologists and reflexology associations in the UK. Do you
Mm.
think there's anything the UK can learn from Canada and take on board? And the other way, looking at how we do it in the UK, do you think things that you could incorporate into the way you work?
Absolutely. So this Reflexology Association of Canada is actually part of a collective of international, national reflexology associations, including the Association of Reflexologists in the UK, where we get together a couple times a year to discuss, membership things. We're seeing an increase of therapists traveling, immigrating to different countries, and just trying to figure out like where our standards match, where are there things to improve, etc. One of the things that we do love about the UK, though it's a little harder to replicate in Canada just because we're so big in the way our provinces are structured. But love that in the UK you have a separate regulatory body for education. So the association don't have to worry about educational standards because it's written on a separate body manages that. Whereas here, like we have to, and without the legal authority, like you can't mandate anyone to follow an association's guidelines if there's no like law or legal authority to back it up. So that's something we just every time I see like the iTech or the off-call things, it's like, yeah, your regulatory for education bodies can manage all of this. Um, the other conversations we keep having are the professionalism conversation. So reflexology is more than a tech, or has become more than a technique now. It's more than just learning a specific routine. It's more than just, getting a client in the chair and getting them comfortable. There's all these things around it in terms of therapists now needing to build websites and be on social media and again work with other healthcare providers, or they're working out of clinics. And I think that some of that professionalism aspect is some of the things that we've been sharing with like AOR in the UK, and they've been sharing with us just how we both can help support therapists more. Um, I lost my train of thought. The research piece, which you're a part of, is also a big. So you guys have started doing research in the UK, something we've been advocating for and working towards getting some researchers on board to do reflexology research here in Canada. Of course, like we follow all the international developments. It's amazing some of the things that have come out, of Australia, and Turkey's always publishing things in the US as well. But of course, for Canadian policymakers and government officials, they're like, all right, but how does it like, what is it here in Canada? So I know that's one of the missing pieces that um, we're working towards, but that you guys definitely need to have taken from AOR and some of the ways you've been able to come up with some good sort of like more in-depth case studies, or even teaching members how to write up some of the findings that they're finding in their clinics, which I think is really important. And then the last piece that I think we've been in talks with here. So we, as an association, I've mentioned that we've stopped looking at hours for courses because we found that longer course doesn't necessarily mean better therapists. But one of the things that we've been discussing that's come out of the UK is that minimum duration. So I know for the AOR's entry standards, what the minimums that they had was that like calendar school year, that
Mm.
of course needed to take a duration of a calendar school year. And here in Canada, there's some gung-ho students that they'll get through all their case studies in like a month and a half or like 3 months, right? So then it takes them shorter to get their certification and then eventually
Yeah.
register with us, which still, I think there's still a bit of a debate of like, if people have shown proficiency in that, should we mandate like they need to actually study this longer? But then there's also the argument for it does take time to get things into your fingers. It does take time, especially if you haven't come from like a biology or a health background,
Mm.
learning all of the body, learning all the systems of the body, how it all interacts, that does take time. Is there something to having, 9 month long courses
Mm.
to ensure proper integration of all of this information and proper integration into your fingers? So I think that's one of the things we're still discussing and trying to see what would make sense here in Canada to move
Yeah.
forward. If having minimum duration of foundational courses makes sense.
Yeah.
But yes, there I think lots
Having
of things from each other.
Having run the diploma course
Yeah,
for nearly 20 years, I'm there with a longer duration,
yeah,
and I've had the experience of it, and I've seen my students feel really confident after 3 months. And then
mhm,
after 6 months, they're going, oh, what was I thinking?
yeah,
And then after 9 months, they are competent, they're professional, they've just got it, they can feel the reflexes, which I think you don't know what you don't know.
that's true.
And so that extra time, even if it's duration, not even if it's not extra face-to-face time, you just need time to put up. So I'm definitely a fan of the minimizing, having a minimum duration because I've seen it, firsthand how students move. And some students will get it earlier and some later, but I still think, it's a minimum duration is it gets my vote. So
Can I ask you a question? Because this, I know one of the arguments here for why students like to get things done a little quicker so they can start their businesses. There is competition from other healthcare practitioners. You mentioned sort of the beauty reflexology.
Mm.
Um, are you also seeing that in the UK, like other professions integrating reflexology into their scope? Are you seeing?
I don't, so the only time we've had that is beauty, and that
Okay,
is it still looks like reflexology, but they are not getting feedback from the feet in lots of cases. I think people that want to do reflexology tend to do a longer course. I have not seen people who do acupressure or acupuncture moving over to reflexology. I've probably trained three or four physiotherapists in the whole of my lifetime to add in reflexology. So that's not many, I don't
okay,
think.
yeah, yeah.
Um, so yeah, I think unless they've done it as part of their course, then if you do a short course in the UK, if you do a weekend course, you basically can't get insurance for it. So that does help.
Yes, no, that does. It encourages people to do the full course, then that
Yes,
makes
yeah.
sense. Okay.
Although the AOR do have to work really hard to make sure that people are, doing the courses that
Yeah,
will give them the competence as you are in Canada. So,
absolutely.
um, yeah. So what excites you about the future of reflexology? Just to leave us with a thought here.
Um, so you were just one of the speakers at our 50th anniversary conference here in Canada, and I hope
Mm.
you were inspired because I think there's a lot to look forward to in terms of reflexology really breaking out into the public consciousness, reflexology being more accepted in terms of integrative care plans, from people going, the oncology route. We're seeing it already with people, struggling to conceive and walking people through their fertility journey. We're seeing it more from like injuries and people recovering from injuries. Um, so I think there's a lot of growth um, that way. The research aspect, there is more research happening, which is great. Um, and we want that to continue because that helps strengthen arguments when you're talking to governments and allocation of resources and insurance firms of, should we put more money into this or should we fund something? It's like, well, here's the research to back it up of why this could help. And then I also think just there's been a general shift since the pandemic of just people wanting to take care of their health. Um, I haven't actually looked at this in the UK, but in Canada, like they've declared a mental health crisis basically since 2022. And reflexology, as we know, can really could step in there to help mitigate some of these symptoms and help with keeping people in a better mental headspace, as well as just keeping their health healthier. Just
Yeah,
so I think there's this is a great moment to get into reflexology because there's a lot of opportunity to grow and a lot of opportunities to also figure like there's a lot of opportunities to build the type of business you want. I think that's the last part is that we're not necessarily pigeonholed into just working from home or you just have to work from a clinic or you just have to work with everyone. We're seeing an increase in people specializing, people figuring out things that work for them, people getting creative. So I think there's a lot of opportunities to kind of build a business that works for you and your family and your time and all of that. So I think that's also something to look forward to.
that is brilliant. And I absolutely agree with everything you've just said. So
Yes.
thank you so much for giving me your time. And hopefully we will speak again soon.
Thank you so much for taking the time and yeah, wishing you a wonderful rest of your summer.
Thank
Stay
you.
cool.